Hello and welcome. I'm very excited to kick off the Growth Layer series and conversation today. We have Izac Ross, who is the founder and CEO of Haven Headache and Migraine Center, a virtual clinic care transforming care for people with migraine. And I wanted to dive right in before we have you, Izac, introduce yourself and talk about what is it that you're doing reimagining care for millions of people living with migraine. Wanted to introduce, if you're not familiar, for those of you who are watching, the series is all about pulling back the curtain on how real growth happens, not just the wins, but also the pivots and behind the scenes discussions that actually shape the journey, especially for life-changing brands and health, wellness, and for families. So Izac, welcome. Very excited to have you on the series today.
Thanks for having me. Excited to chat.
So to kick us off, wanted to see if you could share a bit about your background and the origin story of Haven.
Yeah, the origin story of Haven and my personal experience are very interlinked, which we'll get to in a second. But from a professional perspective, I'm actually a trained product designer. I have been in the world of health tech for my entire career before health tech was called health tech. My first job out of college was at Philips Healthcare, working on the I fall and I can't get up Philips Lifeline buttons, as well as other home remote monitoring services. And then went into consulting for a couple of years, did my tour of duty in design consulting, and then went in-house to my first health tech job. At the time, a company of about 40 people called Collective Health, which was a self-insured insurance company that administered plans on behalf of large corporations, and got to build an insurance company from the ground up, which was such an exciting place to be for that 5 years. Moved on to Alto Pharmacy, worked on pharmacy logistics and that whole world of drug delivery, which is a whole nother wild place to be. And then most recently was at Hinge Health before founding Haven Headache and Migraine Center. Myself personally have had migraine since I could remember, since my earliest memories. I was actually diagnosed at age 2, which is actually very rare. Not rare to necessarily happen, but rare to be diagnosed that young. And for myself and my parents, getting care was a huge challenge. When I was young, there weren't any of the medications that are out now. So I was on, opioids. I was on drugs that are considered kind of barbaric these days. And as I became an adult and had to independently find this care for myself, even working within the health system, it was nearly impossible for me to navigate. In 2016, I had what's called a migraine transformation, which is what every person with migraine kind of fears, which is your migraines going from fairly manageable back into a flare-up zone. Ended up in the ER and was fairly stable before that. So was seeing a regular neurologist, not a headache specialist. And from that day forward in 2016, for 2 years, I had a headache every day or a migraine every day.
Wow.
And it took me 9 months to get in to see a headache specialist at UCSF, 10 months at Stanford, which was just unacceptable, to be honest.
I can only imagine the acute pain you're experiencing too on a daily basis.
Absolutely. I mean, you can imagine like kind of having a level 4, which is not crazy, but like having pain every day is exhausting.
Yeah.
It's terrible. And then in 2018, something really miraculous happened for me, which was the first anti-CGRP medications came out. You can kind of consider these the like Ozempics of migraine. They're the first targeted prevention drugs that have ever come out for migraine other than Botox, which is kind of a brute force tool when you think about it. CGRP is a very targeted receptor that you're trying to hit. So before that, for migraine, the drugs for prevention were Botox, anti-epileptics, antidepressants, and blood pressure medications, all of which have terrible side effects. When I got on that first dose of that anti-CGRP medicine, it was like the first time I felt hope in a long time.
Mm.
And cut a year later, I was no longer having headaches every day. I was going and socializing a lot more. I kind of was experiencing my 20s and my 30s, and got to go do AIDS Life Cycle, which is a bike ride from San Francisco to LA, which I would never have been able to do prior to the advent of these medications. But this treatment I was observing was just getting stuck in academic health sectors. Think the Stanfords, the UCSFs, the UCLAs, um, the USCs in California here, and all of them continue to have this 6 to 12 month wait. And about 2.5 years ago, saw this opportunity to bring this out of the castle of academic medicine and build a health tech company around getting people migraine care faster, and at a way better experience than they could ever at these academic health centers.
Wow.
So our wait times are 2 to 4 weeks versus that 4 to 12 months that is happening right now here in California. But on top of that, we're providing additional support services like our text-based headache diary, that we monitor our patients on a daily basis to see whether our care protocols are actually working for them or whether we need to swap those things out. And that patient doesn't have to wait an additional 3 to 4 months to see their provider again for that follow-up. They can see them same week or next week, to make those adjustments. And
Wow.
what's been incredibly powerful about that is we're able to take what is typically like a 2 to 3 year cycle of making adjustments to get kind of stable down to 6 to 9 months, which
Incredible.
is just a really amazing kind of feat of both our clinical team and our technology team really working together to build kind of a clinically integrated kind of technology platform.
Wow. Wow. That is incredible. And I would definitely put that under life changing. We were just talking before we started this conversation about how 1 in 6 Americans have experienced migraines, disproportionately women. It's something that I have heard about and heard about from my own community and friendships. So I guess so you've had this inherent lived experience your entire life, and that has prompted you to create a solution, especially with the timing of the market and solutions that are now available, and you're making virtual care more available. How did you, I guess, what was your internal experience of, okay, so I want to start this and to be able to solve this for others, and yet, being the founder of a health tech company, it's a big deal, right? I mean, you have to think about, how are you going to get this going? Do you want investors? Do you want a co-founder? And so how did you navigate that internal, this is a big deal, or was it just something that you just had to do, that it was more of a, let's figure out step by step? That's something I'm always curious about when it comes to the mindset and the psychology.
Yeah, it's a great question. It our founding story is pretty funny because I was at Mammoth skiing with a friend who kind of lost touch with, who I worked with at Collective Health, who became a co-founder of Samora. Um, and he was thinking about what's next for him. I was thinking about what's next for me. I've been sitting on this startup idea for like 2 years now and never really pulled the trigger on doing it. Um, and I was at this point in my career where I wanted to break out of kind of the designer box. And I was like, I love design, but it's too narrow for my brain.
Mm.
Um, and we left that trip after talking about it for most of the weekend, and my partner being sick of it and being like, "Oh my god, you guys need to shut up and go ski." Um, that he was like, "Look, YC is in 3 weeks. The application is due in 3 weeks. Let's just try it. Like, let's shoot it out." And like he was actually at that point like way more into it than I did. But then once we like did that initial application, which of course with 3 weeks of thought did not get into YC, we're like, there's a there. We need to go after this.
Mhm.
And as soon as I kind of like really saw it by the numbers, it was like, okay, we gotta go do this. And our biggest barrier to saying absolutely yes, we're going to go do this was actually finding our chief medical officer. So that 1 in 6 stat, totally correct. It's actually 1 in 5 women and 1 in 16 men. So it's very much so 75% of the population is women. There are only 700 doctors in the US that qualify to be our chief medical officer and have a subspecialty in headache medicine. If you do that math, it's like 1 doctor to every 80,000 headache patients. It's kind of crazy.
Yes.
Um, and the biggest risk in starting that company was finding our chief medical officer. And so we did the biggest headhunt we could do with 80 people in California who could possibly be our chief medical officer,
Wow.
and basically gated the company on being able to find this person. We did find Dr. Neda Hindea, who's this amazing headache neurologist who spent 9 years at Stanford Headache Center, teaching, treating, and doing clinical research, but is also just like an amazing person with a very like low ego, which you don't normally meet out there in the wild in doctors. And somehow she said yes and is on this journey with us. And then pulled in one of our buddies from Collective Health to be our CTO, Matt Nugawa.
Mhm.
And the team was sort of like off to the races. We had the technology, we had the operations, we had, me and the lived experience and the design, and we had that MD that we like needed to chase after this.
Wow.
And like once we had that, I was like, okay, we're running for it.
Yeah.
Um,
Yeah.
and you know, definitely made the decision to go after this opportunity to look at angel and VC models. Um, and man, like selling a women's health company,
Mhm.
not that we're 100% women's health, but
Sure.
you know, I really did see the sort of bias out there in venture against kind of women's health disorders, even when they claim that like this is the hot new field, um,
Ah,
which
interesting.
was really interesting.
Yes. Well, I love that story. And what I took from that is the commitment to making it happen. And so I think that kind of leads me, or it triggered a thought around. So there has been a rise in virtual care, which is great. And do you see, so with the lack of mainstream expertise, or you mentioned how difficult it was to find the expertise that you needed to even create Haven, how competitive do you see the space for you and for Haven, and how are you thinking about your unique value prop and keeping yourselves differentiated? Before we jumped on, you mentioned things were going really well. I do want to talk about how
Yeah,
you're, getting to your first patients today. Yeah.
yeah. I think that's a really interesting thing. You know, I think there's just one Haven right now. I don't think there is, you know, big competition for us, which is I'm both thankful and saddened by that there aren't more people working on it. Our big competition are these academic medical centers,
Yeah.
but there isn't really good, solid work being done in the space from a health tech perspective.
Sure.
Feel very kind of lucky that we're in this kind of blue ocean space right now. Um, but that's also really interesting because we want to go and try to capture it all as we can. I think where a lot of other health tech startups have failed in the past in this space is that migraine and headache disorders still require some hands-on patient care. So our model, if anybody looks us up online, is that we're actually hybrid. We're virtual first, which means you see us with, uh, excuse me, we're virtual first, which means that you'll see your provider online for your consult, for your follow-up visits. But in LA, Orange County, San Diego, and San Francisco, we have either through partnership or our own facilities have spaces where you can go and get Botox for migraine, which, by the way, is a covered benefit under most insurance plans. It's been through the FDA process and insurance pays for it. And nerve blocks for high flare-ups. And that ability for us to kind of still see the patient when they need to be seen in person has been really differentiating for us than any other sort of online competitor out there, because we can deliver the full spectrum of headache care. And we're working over the course of the next few years to even deepen those offerings, so that we can truly become the headache center that is our name.
Got it. So has it always been decided to be hybrid from the beginning, or was it more of let's see how virtual care delivery is effective for your first client, for your first patient base, and then evolve from there?
It actually was, because I wanted to be able to use my own service. I use both the new CGRP drugs and I use Botox for migraine. As you can see, there's no wrinkles in my forehead. One of the benefits of doing it since you were 22. But most of it goes all the way in the back of your head and your neck and shoulders.
Yeah.
But if we didn't do that, we would be seeding the people most in need back to these academic systems that were failing them to begin with.
Got it.
Oops, 1 second. Somebody's
Sure.
at the door.
Sure. Okay.
Oh, my partner's got it.
Okay.
And sorry, I want to make sure we capture whatever happened when the
Yes.
doorbell went off. What were you asking me?
So we were just talking about how you wanted to be your own patient and to fill the gaps between what the academic centers were not able to fill. So I think we got that point.
Okay, great.
Yes. Okay, great. And so tell us a little bit more, especially just being a growth marketer myself, and this is what our team focuses on. Curious to learn more about how your first group of patients found you. Like, what does your marketing channel mix look like, if any, especially for a offering like yourselves, where you do have strong product market fit? It's something I've always appreciated about Haven from when I first discovered you.
Yeah, we had this theory when we went off and built Haven that we thought there was a direct consumer channel for us to hit. We tried to keep that a little hush hush as we were building the company, initially thinking we would partner with health systems or partner with providers, which we still do. But we found just such a breadth of need here that direct to consumer advertising on Google and on Meta was a great channel for us. And it definitely took a lot of experimenting to figure out our message and figure out how to actually capture that consumer. But there was this like iceberg model where people only think of what's above the surface, but there's a whole lot going on below of people who are like giving up in the system that they we're trying to navigate through. Like getting into one of these academic medical centers, not only is a 9-month wait, but you have to wait for your primary care provider or even a community neurologist in some geos to fill out a complex multi-page referral form if you're on a PPO insurance plan to go see one of those centers because they have such a long wait. And a lot of patients were just giving up.
Yeah.
And that thesis has really proven out in the way that we've gone to market. We also, though, do try to seek out primary care and OBGYN to do direct referrals into us, which is something we're still learning about, but has shown really great early success for us, and we'll be building on that over the course of the rest of the year.
I love that. And I can see both the D2C channels and then building out B2B partnerships being parallel channels for Haven over time. And I can see both fueling growth in different ways.
Yeah,
Yeah.
absolutely. One thing that we did really explicitly from the beginning completely avoid was the employer channel, which I think is like the classic trap of, well, Hinge did it. Oh, well, Omada did it.
Yes.
That channel is becoming increasingly crowded. And if you're in a minority disorder, even though migraine is not a minority disorder, it's not thought of as like a top 10 spend item in an employer's mind. Your ability to like go out and sell into that employer is going to be like zilch, and you're going to spend thousands and thousands and thousands of dollars on every lead, get into that meeting, and they're like, migraine, what's migraine? That doesn't show up in my claims reports. I don't give a shit. Like, it's you want to talk to me about endometriosis too? Oh my God, I can't say that today. You want to talk to me about endometriosis too? I'm just going to be ignored and laughed out of the room, which is terrible. All these women's pains disorders are nowhere to be seen on any report that a client or employer gets from their payer partner, which is terrible. I mean, it's awful that that's the case.
Yeah, I get that. Okay, got it. Well, then I guess you've kind of talked about this, but I'm curious if there has been any bigger pivots. I mean, Haven is still earlier on. And has there been any big pivots or impactful shifts that you've had to make? And you've covered some of this, so maybe that's it. And I'd be curious to hear about that. I often hear some either inner decisions that are being made or just larger pivots between business models, which, you did touch upon, or your target audience that's also been, that has been made by earlier stage companies.
Yeah, I mean, I don't think we've made like small changes and tweaks. I think we're really lucky in that we did a lot of the work before we ever spent money. I think, we're really lucky that, we took a lot of time to understand, not just from my perspective, but from the community, like what did they need? What would make them switch or seek us out?
Okay.
With surveys and user research, that a lot of the core idea of Haven, other than who we were selling to from a B2B or D2C perspective, the value proposition was kind of there on day one. Not day one, but before we ever spent a dollar.
Got it.
And I think there's an interesting advantage that starting to hear kind of VCs talk about in this age of AI, where engineering is becoming a commodity, where the ability to execute is no longer the barrier.
Mhm.
from a technology standpoint.
Yes.
The differentiation is how do you actually, figure out what a consumer needs and wants. Um, and that is something that as a design leader, I know how to do. Um,
Mm.
and
Mhm.
designers, I think, are going to become more and more of the folks that are going to get sought out for these roles
Mm.
um, over time.
Yeah.
But like diving into that was like super important to me before we really like went after it.
Mm.
And that was a huge advantage. I think the hard thing is being an early company is deciding, okay, opportunities, what are MVPs for each of these things? Because it's possible to do this in a very wide way where we won't be able to do it. And there's
Mhm.
a version where that's too narrow that also will not meet the need. And I think that has been the biggest challenge in pivots is like, how do we sort of put the right pieces together at the right times to unlock their next growth phase?
And actually, I want to talk about your vision for the next growth phase. And what you shared triggered a question in my mind. So, speaking to this group where a lot of your target audience, and especially the amount of research that you did before, to your point, spending a dime on marketing dollars. So, speaking to this target group where many of them have given up, they feel resigned. I'm curious in terms of messaging that is grabbing people. So, something that we're seeing with our brands is we tend to lead with symptoms, right? We're identifying their conditions, we're identifying what they're experiencing versus giving them the answer because we don't know what the answer for them is yet. And really naming them, and to your point, showing them that we understand where they're at. And so I'm curious in terms of the effective marketing messages or just communication, right? Ultimately, that's what a marketing message is,
Yeah.
that is having your group be able to raise their hand and say, yes, I'm willing to give this a shot, even though I'm feeling resigned or I didn't ever feel like there was a solution possible.
Yeah. What we hear a lot from our users, our patients after their first visit is like, I was really skeptical when I saw that ad. Like, and I think we still have some work to get that right. But I think, yeah, leading with symptoms, showing that we understand has been a really important thing. But figuring out how to get somebody to believe that from an ad is something we're still working on for sure. I
Sure.
think we're getting there.
Sure.
One thing that I know and I feel like really great about that is working for us is once they give us a call,
Okay.
the way that we show up our compassion, our understanding, we're not rushing them through that making appointment step. We're
Mm.
asking them about their lived experience with migraine and their headaches. We're asking them about their past failures to trying to seek treatment. And like I'll often get off a call with one of our patients because in the early days I was doing a lot of our intakes, probably like 20 a
Oh.
week. And it really allowed me to learn about like what isn't resonating in our messaging. But they get off the phone with us and they're always like, no one's asked me this before. Like, like no one has like spent time like understanding the headaches. They're still skeptical until they have that first appointment. Um, but just giving people with chronic disorders the space to be heard has been something that I think has been really powerful. I think we haven't fully backtracked that into our messaging or our work. But I think the thing that has really drawn people to us is this like this weight. You see people all the time who are like, I have an appointment in 9 months with UCSF. I can't wait that long.
Wow.
Um, So I think our success is somewhat of the failure of the academic system. And I wish there was a better answer than that.
Yes, yes.
But we're taking advantage of the failures that exist out there.
Yeah.
I think for us as well, which I don't think we actually covered in this, is like we're in network. We don't have any additional subscriptions. We don't have any additional barriers. As long as you're accepted in the plans that we take, which are pretty much every PPO in California. Unfortunately, not yet a lot of the HMOs, but like the the trial risk for them feels a lot lower because they're not
Yes.
paying out of pocket with this.
Yes. I love
Which so many of these online services still do.
Exactly. And that to me just makes so much sense for it to be in network and for folks who really need it to be able to give it a shot.
Absolutely.
Well, I think that the value and what you're offering and the problem that you're solving for is undeniable and so needed. I myself, I've been very fortunate to not have had to deal with migraines, and I unfortunately know plenty who do. And so let's hear about what's next. Like, what's your vision for growth in the next phase? There's a huge population to tap into, even if as you're looking to expand outside of California. So what's next? And then how can people find you? And then how can people find Haven?
Yeah. Next year, we're hoping to grow into at least one more state. As we talked about, our hybrid model.
If a patient or if someone wants to become a patient and they're not living in one of the states that you'll be rolling out into, can they take advantage of the virtual care delivery only?
Oh, unfortunately not yet. But
Okay.
I can say if you happen not to live in California, if you hit the sign up for intro call button on our website and fill out your information, we will notify you when we're in additional states. But right now, we're only licensed in California.
Got it. Okay, great. I just wanted to clarify that because there's huge.
That's a great question.
That's going to want to take, be able to gain care. Well, I think that the value and what you're offering and the problem that you're solving for is undeniable and so needed. I myself, I've been very fortunate to not have had to deal with migraines, and I unfortunately know plenty who do. And so let's hear about what's next. Like, what's your vision for growth in the next phase? There's a huge population to tap into, even if as you're looking to expand outside of California. So what's next? And then how can people find you? And then how can people find Haven?
Yeah. Next year, we're hoping to grow into at least one more state. As we talked about, our hybrid model. We're not planning to be in all 50 states next year. We're planning to continue our growth, our support in a state-by-state basis. I hope year over year we're adding more and more states and localities. I'm hoping that we're bringing more and more technology into our experience to scale it and be able to offer it to more and more people out there. As to where to find me, I'm pretty much on every platform at Gay with a Headache. And you can find Haven on every social media platform at havenheadache.com. And if you're in California, you have friends or family who are in California who might need help with their headaches or migraines, it's really easy to book an intro call with us at havenheadache.com. We're in network, as I said before, with pretty much every insurance, PPO, Medicare, and TRICARE, and hope to have anyone who's listening as a patient and help them out with their journey to what we call more good days.